all the rain we had recently was a nice break from the high temperatures, which are back, but that also produced mosquitoes and other bugs that are now out and they're hungry. Dr. Vijay is here today to help us figure out the difference between all these different bug bites and what we may need to do about them or not do, as in scratch.
That's right.
Good morning.
Good morning. How are you?
Doing good and getting attacked by mosquitoes now.
Yeah,
They're out.
They're all out there. It's a time-based thing. Essentially, for a mosquito to reproduce, it needs little areas of standing water. So as long as there was no rain and we didn't have any water, we didn't have a mosquito problem.
Exactly.
Rain show up, mosquitoes lay eggs, and a few weeks after that, we have all the mosquitoes out there and they're hungry.
Now, I spoke with a pediatrician last week who said that right about now he would start seeing in his practice a number of children coming in with huge sores on them,
That's right.
apparently from just scratching the mosquito bites.
Right. When a mosquito or anything bites you, obviously the first thing you feel is the pain. And after the pain goes away, your body has an immune response to that area for the mosquito proteins that are left behind in that bite. So one of the things is it gets a little red, it gets a little swollen, and it gets a little itchy. So these are things that everybody experiences, but obviously kids don't understand, and they can just keep scratching the mosquito bite area to the point that they can infect the bite. So they're doing more harm to their body than the mosquito did, so they can come to the physician. What needs to happen is, especially with little kids, there are creams that are available, either over the counter, or you can go see your pediatrician or your family doctor, and they can prescribe you these creams that if you wipe on the mosquito bite, they actually counteract the histamine and make the itching go away and help with the redness and help with the swelling. So it's real important to treat these, especially in those kids who tend to scratch a lot at the mosquito bites.
And what about allergies? What can you do about the allergies? Of course, the young man that was killed by the ant stings over at Haas Middle School during a football game, who knows what they're allergic to, and is there any kind of shot you can get or things you can keep with you throughout the year? Or?
Well, there's definitely things that you need to keep. First thing is prevention. That's the most important thing. So if you're allergic to any organism out there, you need to stay away from it. So if you're allergic to mosquitoes, which I don't know very many people who are, but if you're allergic to bee stings and things like that, and you're going out, say, camping, which may not be a good idea, but if you have to, then it's a good idea to spray yourself with many of a whole lot of insect repellents that are out there. That's not 100%, but that does a good job. Second thing you need to do is get trained by your doctor to use something called an EpiPen. These medications will actually counteract some of the severe reactions that occur with allergies. Allergies are something you generally tend to have or not. The first time you get stung by something that you could become allergic to, you don't have the full-blown reaction, but the next time you would. Unfortunately, not everybody knows, and there's no way to be 100% prepared, but it's a good idea to have an EpiPen if you think you might be allergic to something.
Okay. Well, thank you for joining us this morning, Dr. Vijay, with some tips and some advice. And if anyone out there ever has a medical question they need answered by our doctor, email us here at the station or send your question